All right, well, welcome everybody. Apologies for the slight delay in getting started. We've had a few people flying in from all over the country today, and we're now all here and ready to go. So thanks very much for coming along. Today is a special day. It's a mini symposium where we've brought together experts from around the world, including the UK and from Melbourne and from Sydney, to discuss a really important issue, which is that of the potential of using a procedure called mitochondrial donation for the treatment of mitochondrial genetic disease. And it's really one of those rare opportunities where we're bringing together research, and it's right now at the interface of being introduced into clinical practice, and after many years of research, it's really on the cusp of that happening in the UK. So I'd really like to welcome our international speakers, in particular Mary Herbert from the University of Newcastle and Nancy Lee from the Wellcome Trust, both of whom were really critical in both scientific development of the technologies and techniques, as well as helping to formulate and develop the policies around the technique. So it's very good timing to be having this meeting now. This is, in case you don't know, is Mitochondrial Disease Awareness Week, I believe, Sean. It is, and Sean Murray, the CEO of the Australian Mitochondrial Disease Foundation, is with us, with others from the AMDF, and we're really welcome you here as well. And really, in terms of the organisation and management of this meeting, this is really an event hosted effectively by AMDF. There was a meeting in Sydney held on Tuesday, which was a very patient-focused meeting. We've decided to have this meeting much more focused really around the science and the technologies of mitochondria and mitochondrial donation. And so I think the two meetings really marry very well, and I hope that with both those meetings taking place, the science together with the real patient need and the patient focus for this treatment is really going to get some focus in the future. So I think with this quote from Sean that we've got all got on one version of your programs, we're so organised, we've got two programs, that we really, 1 in 200 people carry a change in their mitochondrial DNA that can cause mitochondrial disease. Now, this was really something that I didn't know about when I started getting into mitochondrial biology research. I didn't realise how prevalent mitochondrial disease was and what the impact it had on patients was. But at the moment, there's no way of preventing the transmission of the mutated mitochondria from a mother's egg to her children. Okay? And it affects all of her children, but it will be then carried on by her daughters potentially in her eggs to subsequent generations. And so the challenge is how to stop that propagation of genetic disease, and that's what we want to be focusing on today. Really, is mitochondrial donation as a technique provides that opportunity, but it needs to be considered very in depth and very openly in discussions like we're having here today. So it obviously has a major impact on patients, and today Sean Murray will be giving us a perspective from the AMDF's point of view about the patient experience in this. But it's really that link between a real patient need and science at the cutting edge that we really want to be focusing on today, and making sure that we can start to have a really sensible, reasonable and informed debate about this in Australia. So mitochondria exist in all our cells, and as most of us will know here, they really act as the power plants, or if you like, the batteries of our cells. And Mike Ryan's going to tell us a little bit more in more detail about how they do that in his talk. And really, due to the quite fascinating evolutionary origins of mitochondria and our cells, which I hope we hear in one of the talks today, mitochondria have their own genomes. It's a very small genome, 30 odd genes in the human, a smaller number in other mammals, but it's a small genome of about 30 genes, most of which are involved in producing that. There's quite a few. It takes quite a few genes to actually run a genome, but also the genes that are involved are often associated with energy production. So they're important genes. So we'll hear a lot more about that from David Thorburn and others as we progress through the day. So the approach to being able to really modify this genome in patients is really one where it's a matter of transferring a nucleus from one embryo that has damaged mitochondrial DNA to another that doesn't. And the technique is, I'll just briefly show it here because this will help to put everyone in the same context for when all the discussions happen later in the day. If we have a patient with a serious mitochondrial mutation, of course, these little black dots here are mitochondria, and the nucleus of this one-cell embryo consists of its maternal and paternal DNA. That's removed from the embryo with the damaged mitochondria and transferred into a nice healthy embryo here. We've got a very nice healthy pink mitochondria and mitochondrial cytoplasm here, and this nucleus is transferred into this healthy cytoplasm to create an embryo that has its nuclear genome present in an environment where the mitochondria are healthy and don't have any mutations. So in order to generate this is one of the ethical questions that is needs to be addressed. In order to create this model, we need to be able to remove a host nucleus from the healthy embryo. So it's really a case of mitochondrial donation, where the embryo is where the donor embryo is donating mitochondria to the new nucleus and creating a healthy, what we hope is a very healthy embryo. So the technique itself obviously requires a lot of skill and a lot of practice, but it's a relatively old technology. I was talking to Mary earlier. This technology was first developed in the 1980s. It's been around for a long time. It's been used in many animal models before. So it's not really a barrier to moving forward. The technique requires refinement. It requires development in the human model, but it's a technique that is a relatively old technique. And Australia have been pioneers in this field of using reproductive techniques to really improve fertility. Here, there's the opportunity to use reproductive techniques to really improve or decrease the risk of genetic disease. And so I think it's very important that we take this in context. This is what we're talking about today is genetic disease, and using reproductive technologies to be able to get around that problem of genetic disease. So let me just come quickly to the program, and then we'll move on to the first talk. So we've got a great program, and I've welcomed most of the people here already through this introduction, but we're going to start out with Mike Ryan. Mike is an expert in mitochondrial cell biology. He's been working on mitochondrial function for many years. He collaborates closely with David Thorburn from the Murdoch Children's Research Institute, who is a mitochondrial geneticist and works with many clinicians and patients. And he'll be giving us a real context of mitochondrial disease in Australia. We'll then hear from Sean Murray, from the AMDF, who'll tell us a bit about the AMDF and how it's trying to work to improve the lives of patients and to really further the research in the area. And then our first international speaker, Mary Herbert, will give us an up-to-date account of where the research is in this important area. And I think this is it's important to realise that Mary works, leads a very big team back in Newcastle, of which it's a really potent milieu, if you like, of a major mitochondrial genetic disease program and a very strong fertility clinic, and bringing those two together to be able to treat the mitochondrial disease has been a real great example of collaboration, and they've done enormous work to get it to this state in the UK. So the afternoon session, we then move on to considering various safety, ethical, legal issues, and it's great to have Damien Dowling here from Monash, who's a geneticist, and he'll give us a talk about some of the potential risks and issues that we need to consider when doing these when transferring mitochondria into a new the genome into another mitochondrial environment. And then we'll hear from Ainsley Newsome and Louise Johnson, who've joined us today to discuss some of the more of the ethical and regulatory frameworks which probably is one of the major challenges in Australia that we have. And finally, we have Nancy Lee, who has been really critical for helping to develop the framework for the Wellcome Trust in their position, and how they've helped to support the introduction of mitochondrial donation, at least getting the legislation changed in the UK. The meeting wouldn't happen without its sponsors, so I'd like to thank Monash, AMDF, Murdoch Children's Institute, and the Wellcome Trust for helping to put this program together.